Imagine it's December 18, 2025, and our patient has basically a herniation, two herniations to be exact, L3-4, L4-5, left side. Now he's already undergone the Deuk laser disc repair at exactly these discs almost a year ago, and he re-herniated. He blew out the discs again before they healed. Our reherniation rate is 1%. We've done now 2,726 Deuk laser disc repair surgeries, and in 2,726 DLDRs, we've had about 25 reherniations that we've had to reoperate. So we're just under 1%, but he's one of them. And I feel horrible, but his options were either do a laminectomy, remove bone and ligament, or go back and try the Deuk laser disc repair again. He opted for trying the Deuk laser disc repair again. I think it's a good choice. He doesn't want invasive surgery. You ready? So we're going to be on the left side. He has left leg numbness, weakness. It's been going on for about a week and a half. I don't remember exactly what he was doing to make himself reherniate, but I think it had something to do with exercise in the gym. Could be mistaken though, so don't hold me to that. All right, everybody agree 3, 4, 4, 5? Which is the worst one? I think they're both pretty bad. I think 4, 5 is the worst. I'm going to start at 4, 5. Actually, I'm going to come a little bit more lateral shot. Let's do a little numbing medicine. If you have questions, feel free to type them up. Once again, this is a reherniation, lumbar. Patient had the Deuk laser disc repair already. He then reherniated a couple of weeks ago, got weakness in his left leg, numbness in the left leg, and we gave him a choice. You can do something invasive, or we can try the DLDR again. He wants to do the DLDR again. I think that's a very reasonable choice. It's what I would do as well. Shot. So let's hope this works for him. Shot. Oh, I can almost feel like I feel the herniation here. Give me an AP, please. Any questions? Type up your questions. All right, looking good. We're heading right for that herniation at the L4-5. Once I'm in, I'll place my second needle at 3-4. Shot. Man, that's a big herniation. I can feel it. Shot. How is he? Man, feel a lot of scar tissue in there. All right. Is he okay? I'm going to move on to the next level, L3-4. Go ahead, Luis. Any questions, Henry? Shot?
At this moment, no current questions.
All right. Thanks, Henry. So let's show the audience who are watching, why do people get back pain? What is the cause of back pain? MRIs don't tell us where back pain comes from. Patients tell us where they're having their back pain. And then, of course, we use the MRI combined with the patient's physical examination and history to identify the source of back pain. In his case, it's not really back pain. It's more herniation with a pinched nerve. AP? I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. You've now seen the 30 different causes of back pain. Once again, this patient is not here for back pain. He's here because he re-herniated. The herniation his disc spit out is much bigger than the original one I dealt with a year ago, and it's huge. Here's a piece of it right here. Oh, that's a big one. Look at that, guys and gals. Look at the size of this herniation. Look at this. That's not the whole thing, by the way. That's just part of it. You see it?
Yes, we do.
Look at that. Put it down. That is a big one. That's just one piece. I'm telling you, there's more. We're going to go get as much as we can. And I told the patient we're not going to get all of it. There's no way to get all of it. There's no surgery that gets all of it. Actually, I need the grabber again. Unfortunately, spine surgery, herniated disc, we cannot make your disc look normal. Nobody can. Oh, there's another piece right there, another big piece. Not as big as the other one, but again, they're going to add up to quite a bit. So remember, he had surgery a year ago. He did great for a while, and then he re-herniated. Ooh, I just tried to pull that piece out and it broke. Let's see. There it is. It's so big, I can't even pull it out. It's just breaking. We call it friable. It doesn't mean you can fry it like an egg. It just means it's falling apart. So the herniation is friable, meaning that it's, breaking apart into pieces. There are some lesions in the body that are like that, friable. And honestly, it doesn't matter as long as we get as much out as we can. But once again, we'll never get all of it. It's just not possible. Oh, I can feel it. Oh yeah. I just felt it tear again. There's a big chunk in there. And I'm grabbing it and it's just breaking. But we'll get it. So you guys can sort of see it there. That's not the only herniation, but that's part of it. Oh my Lord, it's big. I just can't seem to get it. Just wipe it. We got that one big piece right in the beginning, and I'm going to just try to pull it out as many pieces as I can. Look at that thing just sitting there laughing at us. It's too big to fit through the tube. That's the problem. It's literally too big to fit through the tube. The tube has trapped it. Oh, there, I might have gotten it. Oh, that's a good one. That's another good one. Again, not the whole thing, but that's another huge piece right there. You guys see it?
Yes,
that is the herniation that was pushing on his nerve. But there's more, okay? I sound like a Ginsu commercial. But there's more. Get 12 knives if you act now. Oh, there's another huge piece. All right, we'll show it to you later. We're just going to keep this collection going. So far, I've taken out like 3 really big pieces. There's another piece right there. All these pieces are just coming out. All right. So, what happened? This person had a successful procedure about a year ago. Was doing good from a disc standpoint. And then did something, an exercise, I think, if my memory serves me correctly. And that exercise just, unfortunately, his disc was not ready, not healed, and it just blew out more fragments of nucleus. Once it blew out, it got so big it pinched his nerve going down his leg. He came in with weakness, numbness. He couldn't even walk. He was using a walker and lost the ability to walk independently. We got him to the surgery as quickly as we could, and here he is. Any questions?
At this moment, no current questions.
All right, so basically, unfortunately, his case highlights the 1% of Deuk laser disc repair that reherniates. 1 in 100 patients will reherniate. Doesn't matter what we tell our patients or what we do, it just keeps happening. But I think if people learn to really respect their body and respect the need for healing, that they will take it easy for a year and just let their back heal. Just because your pain is gone doesn't mean the disc is healed. That's really the main message here. This is all pieces of herniation. I should say reherniation. All right, Henry, since we have no questions from our audience, then, oh, there's another piece. Where's the other ones? Oh, well, you're collecting them. I want to show them at the end. No audience questions?
No current questions.
All right. Then let's show the audience how we do the Deuk laser disc repair.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Henry just showed you guys our video on how we get rid of back pain using the Deuk laser disc repair. But as I said, for this patient, it's not back pain, it's really weakness in his leg. He has a pinched nerve. And pinched nerves, they don't cause back pain, but they do cause, oh, there's the monster. There it is. Look at this, folks. Holy macaroni. Can you guys see the
Yes,
size
we
of this
can.
thing? There it is. Look at all this. This is the one I just took out. It looks like a baby. Wow. Look at all this herniation. You guys see it all?
Yes, we do.
That should be about it. I don't know that there's much more herniation in there. Let's see. We're going to go take a look. But what I was trying to tell you is, for this particular patient, he's not here for back pain. He's here because he reherniated his disc after the Deuk laser disc repair. Yeah, I guess there's still some more left. And he got weakness in his legs. He could not lift his leg at all. And he had, oh, that's another monster. Wow. Well, I hope he watches this video so he can see what all the pieces of herniation we're taking out. That's amazing. That's amazing, guys. Wow. I thought you can't have any more than that, but he's clearly proving us wrong. All right, back down the rabbit hole. Let's see. But he's going to do great. I think this is very encouraging. When I see this, I'm thinking we're getting a lot of herniation out. And that makes me happy. That means my patient's going to do good. That's all that matters, is that he's going to do good. All right, we're just about done. There's the last of the disc right there. Any questions?
No current questions, so we do have a comment coming from Doug on Facebook
Hi, Doug.
saying, all I know is you're awesome, Dr. Deuk. I wish I could come see you.
You can come see me. You can come see me. I don't know if we can fix you, but you're welcome to come see me, my friend. And I hope you take time to do a MRI review with me if you have the opportunity. I would love to tell you what's wrong with your back or neck and at least give you a diagnosis if we haven't done that yet and help you. I wish to God I could fix everybody. That's my wish. I wish everybody could come to Deuk Spine to get fixed. Trust me, if I had the money, I would fix everybody. I would open us up, not charge anybody anything, and just fix everyone. Just free surgery for everybody, all day, every day. That's what I would love to do. Money should never come in way of pain relief, or suffering. All right, we're just about done with this disc. This is another piece of herniation. Now this one, unlike the other ones, is starting to stick to the disc, to the annulus. You guys see that? I'm having to use the laser a little bit to release it.
Yes, we
That's
do.
what happens once you get a herniation that's been there for a while. It literally starts to stick to the annulus, and then you have to use the laser to release it. But I'm not getting any more pieces of herniation. I think we're clear. I am going to look a little bit more medial because that's where the nerves are, just to make sure I can't pull out any more herniation. And we'll see. We got really lucky that we were able to get so much herniation so quickly. Let me just look again. Yeah, when you see the blood like that, what that means is that we've decompressed the epidural space. That's a really good sign. When I used to do microdiscectomies, we would look for that. It's an indication that the herniation has pretty much been taken out and it's gone. I'm not going to just rely on that. I'm going to try to get a little more if I can, because I don't want to have to come back again for this patient. I want this to be it. I want him to be done. I know he's going to be very careful with his back going forward. All right, let me just take another peek. I'm going to show you guys, not right now, but in a little bit, the herniations we just took out. They're massive, 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 massive. All right, I cannot get any more herniation out of this tear or the epidural space, so I'm pretty happy with that. We're going to move on to the next disc. Any questions?
At this moment, no current questions.
Irrigation? All right, Henry, let's show the audience how we use the endoscope and laser and grabbers to actually fix people's disc problems, such as a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, degenerated disc, spondylitic disc, collapsed disc. All of those things, they cause the symptoms for the same reason. It's really due to two things: inflammation in the posterior annulus causing back pain, and inflammation causing leg pain, or compression of the nerve root, which causes weakness, numbness, and tingling. This patient had nerve root compression. His reherniation was massive, and it's big at both levels, both 3-4 and 4-5. So I think 4-5 we're going to see a big one as well. You can actually see it on the discogram. You can see a big herniation. All right, any questions?
At this moment, no current questions.
So to summarize, we finished our Deuk laser disc repair, laser spine surgery at left L3-4. Now we're moving on to left L4-5. And this will be our last disc shot. After this, we have another patient who travels here from New York, New Jersey area with his lovely wife. I just met her. And he has been watching our surgery for a long time. He's watched, he said, hundreds of surgeries. And that's what convinced him to come here to Florida for back surgery. Now his wife actually works at the hospital. She works at Sloan Kettering across the street from Hospital for Special Surgery. But they were offered fusion for his back up there. He said, no way. I'm not doing invasive spine surgery. I'm coming to Deuk Spine. So even though they work in the hospital system, his wife does, they decided, we're getting out of here. We're coming to Florida because Jacob and Jordan, Luis and Berndes, Hector, Nikki, And of course the banana bread. I'm just saying that because Dr. Berndes' wife just made banana bread, which is unbelievable. Honestly, best banana bread I've ever had in my life. Best banana bread. All right. I'm literally pushing against the herniation right now with my tip of my dilator. It is, I can feel it. It feels like unbelievable. It's huge. All right. I just pushed it away from the nerve, and we're going to go collect it. It's an amazing surgery. I didn't invent the endoscopic part. That was invented by doctors much smarter than me. But I did invent the annular debridement, which makes the surgery very effective for treating back pain. And more importantly, it allows the disc itself to heal properly so that we don't get reherniation. The key, though, is to wait a year before you do anything strenuous. Any questions?
At this moment, no current questions.
All right, so folks, I'm going to tell you right now, you're going to see a pile of disc herniations bigger than you've ever seen in about 10 minutes when I'm done, because I haven't seen herniation that much in my career. There's some more right there. So we're going to fish the rest of this herniation out, and then we're going to show you guys all the herniation. There's a lot. Oh yeah, there's a piece. Where do you want it? It's right here. All right. If I get a monster, I'll stop the show and show it to you guys, okay? We call that a showstopper. Right, Nikki? Showstopper. All right. Any questions? Oh, that's a biggie.
At this moment, no current questions.
Oh, I feel it. I just tore. Well, Henry, let's just share with our audience. Let's do a little comparison. Deuk laser disc repair versus the other kind of treatments people are often recommended by their doctors, like laminectomy or discectomies. Hi, I'm Dr. Deuk Majan. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. We've had a little fun while you guys were gone here in the operating room at Deuk Spine Institute. That said, we are getting close to the end of this disc. L4-5. It's broken.
Nikki, can I have another one, please? Another Nikki Daddy.
No, it's fine. I didn't know if it was running down or not. Let me have, well, how many of these do we have?
We have plenty. We have probably 10 or more.
Ah, Get a new fiber. I've done some bad things with this fiber. Watch the fiber on the floor. Yeah, the problem is when you... We may need Grabzilla. Do we have Grabzilla?
Yeah.
Nikki, grab Grabzilla. I want to take a look. This would be a good one for Grabzilla. Let me know when you have Grabzilla. What do you have? The other one? Let me have the other grabber. The other one's broken, right? There's not much that can be done about that, right? It's for the garbage. Well, we're just talking about a pituitary rongeur that I broke. Laser. Any questions?
At this moment, no current questions.
Now we have shown the audience so much, right?
Yes, we have.
Berndes? He's fine for me, but a little bit of movement. I'm all right with it, if you're all right with it. You have Grabzilla, guys? Let me just take a peek. So we're going to bring in a specialized instrument. We call it Grabzilla. And I'm going to go right for that residual piece of herniation right there. Feel free to ask any questions. Look at Grabzilla. Grabzilla is articulating, so it can actually angle upwards, which is medial, towards, hold the tube. Don't let it go in. It's going to want to go in. Oh yeah. There's another piece. Grabzilla is not good at pulling out big pieces. Grabzilla is good at cutting and pulling pieces. And it's not cutting like a scissor. It's more or less just cutting with its mouth. Let's take a look. I need the other grabber. So here we are at the very back of this disc, and we were grabbing this stuff right here. You can see the epidural space seems to be moving quite well, but I'm not entirely convinced we're done. So I'm going to keep going. I'm going to use the laser there and remove some more of that ligament. And it's a little bit of ligament called foraminal ligament. It's part of the ligamentum flavum as it extends laterally. The nerves are just at 12 o'clock and at 9 o'clock. And what can I see here? Some of this will be scar tissue. That is fat around the dorsal root ganglion. We don't want to mess with that too much. Dorsal root ganglion is the exiting nerve, sensory ganglion. Looking laterally. Don't want to leave any lateral herniations here. About 3 minutes is my expectation. That is the back of the disc. I don't really see much more herniation. This is a little scar tissue and ligament. I'm looking for any residual pieces of herniation, but I'm right up against the front of the dura mater. right where the nerves are at the back of the disc. Let me just take another peek. Any questions? We're just about finished. I want to make sure we're not leaving anything. There's epidural fat. There's that nerve over there I was talking about. This is definitely the back of the disc. You can see some scar tissue. There's the dura over there to the left at 11 o'clock up there. I just don't see any more herniation. I think we've got it all, but let me just quadruple check. Here's some fat in the foramen. There's the nerve root right there. That's going to be your left L4 nerve root. Sometimes you get a little herniation right there in that crack between it's the sort of the axilla. But if you look, you can see that everything seems to be moving nicely. And if there's anything left, it's going to be right in this area. And I don't see very much at all pressing on the nerve. Now remember, in surgery you can do too much, right? You can get too aggressive and do something you don't want to do. But this is mostly scar tissue right there. I don't see, that's your ligament, your PLL. There's the dura right there, above there in that crack. Let me just get a little bit more, a little epidural vein bleeding. This really looks to me pretty good. I don't know that I can get much more out of here. About 1 minute left. I'm just opening this to look. And he doesn't like it. Last check. I just don't see any more herniation. Let's get all the herniation pieces together. There's the epidural space up there. You guys see it? And this is sort of the back of the disc, and there's a little bit of the facet joint. I mean, this thing looks good. I can't get any more out. You guys can see I'm in the epidural space up here. And there's the PLL. There's the nerves and everything up there. And I don't see anything else. So I think we're good. I think we did it. I think we did it, folks. I think we're done. I think he's going to be happy. I'm going to show you. Wow, Luis just put it all together. This is probably 70% of what we've taken out. You guys see it here, Henry?
Yes, we do.
Each one of these is a piece of herniation. You're not so generous with that irrigation.
One more?
No, I think we're fine. We're fine. So take a look at all these pieces of herniation. All right, I'm going to show it to you in just a second. Let me take this tube out of the patient. It's a tubular retractor.
Scope up, please. Thank you.
All right, so we did everything. Look at this. Look at this cut right here. You guys see the cut
Yes, we do.
right there? Look at all this came out of that cut. Plus we got more down here. I'll just flip it up. You can see all the little pieces and some in the bag. All right, let me just staple this and then we'll show it all to you guys. But this is an unusual amount of herniation, but he really blew this thing hard. He blew it out. I mean, this is a pretty good size amount of herniation. I put it up in the 85th percentile. All right. Okay, so there it is. Show us the grabber, the little grabber that we use. Just pieces everywhere of herniated disc. Here's our grabber. So we took all this out. This is what was pushing on his nerve. I think he's going to be a happy man, but let's just hope he doesn't reherniate again. I've done, like I said, about 25 reherniations, and it's probably more around 23. I think I had 2 patients who didn't want surgery, but so 25 altogether, 23 operated. And you know, the 23 that I redid, the patients did great. They never reherniated again. They didn't need anything else done. They went on to have a normal life. Very happy. All right. Nice talking to you all. We'll see you again shortly for our last patient from New York. New York City. I'm Dr. Dumajan. I'm here with one of my lovely patients who came to Deuk Spine Institute with a problem with his lower back. I can tell you he's had a laminectomy before. It didn't work. He looked us up, came here yesterday, had the Deuk laser disc repair. We fixed 5 areas on his discs. And how are you doing today?
I'm very emotional. I got home yesterday and the sunset was behind me and my wife took a picture of me thanking God for what happened to me yesterday. I've had back pain since 1973. I got hurt in the Army, putting helicopter blades back on a helicopter. I lived with it for over 50 years, pain. 3 years ago, the VA decided to cut 3 bones off my spine. I've been unstable and on a walker ever since. My life has deteriorated immensely. I was 208 pounds 3 years ago. I'm barely 200 pounds now, and it's not because I wanted to lose the weight. All my muscle is gone because of what happened before.
And did the VA surgery fix your problem?
It made it worse.
That was a laminectomy.
That, when they cut the bones off my spine, whatever you call it. But the thing about it is that after that, it took me 3 years to even get them to, I was at 30% disability to begin with, and it took them 3 years to get me to 80. And then now I'm at 90, but I haven't been able to work. I haven't been able to mow my lawn. I can't ride my Harley Davidson anymore because of the surgery that they did, the instability. I've been in the ER 15 times since that surgery from falls. It's the worst feeling in the world to be a 280-pound farm boy down to a 200-pound, very weak-minded, weak strength. I can't get up and go do anything without a walker or somebody with me until yesterday. What you did for me yesterday, there's no amount of thankfulness that I can show you or tell you, except that I took you for a man of your words and you came through for me. I walked in here without my walker. I've been walking around this morning without my walker, and I don't feel like I'm gonna fall. I'm not afraid anymore. I got hope again. I got hope to be a man again and
Good.
be self-worth.
You had the Deuk laser disc repair. We went in and fixed 3 discs, but 2 of the discs from both sides because the nerves were being pinched on both sides. And now you're walking without the walker. You feel like a new man.
I feel like a new man, but hopeful to be a great man again. And I thank you with all my heart. My family thanks you.
You're welcome. And you can see in the surgery we did on your back that we went in with the laser and we cleaned out the tears and got rid of the herniations, and now your discs will heal naturally. We didn't put anything artificial in your back. You have your natural spine. You didn't need the laminectomy that the VA did. It was unnecessary and it put you through a lot of pain and suffering. Are you on any pain medication today?
You know, I didn't even take Tylenol for my neck at all. I have no pain anywhere in my body, none. I can feel one spot that it feels like something happened there, but it's not painful at all.
Well, is there anything you want to tell your people out there?
Anybody needs to check with this clinic and this man right here and the staff here is just absolutely unbelievably wonderful. I got treated with so much dignity and fun, actually, yesterday. It was a blast. Anybody that has questions, do not allow people to cut into your back until you do research. And this is where you need to start your research.
Thank you. Thank you.
I appreciate it so much.
Well, we love our patients, and we especially love our veterans who are patients.
This one sure loves you, buddy. Thank you so much.
Take care. You take
God bless you all.
Thank you.